Hi guys, welcome back to Sunny Learning. Today's video will be a pathophysiology video talking about obesity and why obesity is a very problematic concern, especially in today's population. So, obesity, I think a lot of you know what obesity is, and but no one actually knows why obesity itself is a problem. Like, what actually makes obesity a concern? Because all of you might be saying obesity is just, when you're overweight a bit too much and you get your arteries clogged. And that's just the general sort of way that most people think about obesity. But you have to actually understand what makes obesity like a problem. So the main problem that makes obesity an issue is the so-called visceral fat. Now, visceral fat just means the fat that basically surrounds your organs and whatnot. And you can get several types of obesity depending on your distribution. So some men, most men will have so-called android type of obesity where they look apple-shaped. So that basically means most of their fat is situated in the abdomen. But you might women also have gynoid type of obesity, and that's where the fat is distributed more towards the thighs and the legs and whatnot. You can also have types of obesity based on pathological causes. So things like a low metabolism rate. Maybe you just eat more than you can actually expend. Maybe something to do with the regulation in the brain, specifically the hypothalamus. Maybe endocrine related, like thyroid hormones. Things like drugs as well. Antidepressants can increase the risk of obesity. So that's the types of obesity. Now, what makes obesity itself, like I said from the start, a problem? And it's to do with visceral fat. Visceral fat is a problem because visceral fat contains all of the hormones sort of side of things when it comes to regulating, the amount of, whether it comes to insulin regulation, whether it comes to inflammation. Most of the signaling happens from the visceral fat. So the visceral fat is responsible for the endocrine side of things. And it's this visceral fat that if there's a problem, then it can lead to several other types of problems. So with the visceral fat, the visceral adipose tissue, there are several signaling molecules. For example, adipokines. So adipokines are like the adipose tissue specific hormones or molecules which basically are responsible for different things. So for example, regarding the metabolism part, things like leptin, resistin, adiponectin, adipsin, these all sort of affect metabolism in one way or another. And for example, resistin, you can kind of from the name tell what it does, but basically resistin, if you have an increase in resistin, which most obese people have, when they have lots of visceral fat, they will have lots of resistin. Lots of resistin leads to beta cell resistance. So that means the amount of insulin that is produced will be sort of downregulated, will be resistant, and therefore that can lead to obviously diabetes. You can also have an increase in adiponectin, which also contributes to beta cell resistance. And adipsin is kind of the opposite. It actually controls beta cell sensitivity. So so the more sensitive you are to insulin, the more its function is like heightened. But sometimes in obesity, you can have a decrease in this, and that can lead to also insulin resistance. So that's how you can see the relationship between obesity and diabetes. So how obesity can cause diabetes, and I'm also going to talk about how diabetes can affect obesity. So the other way around. Regarding with inflammation, so these are cytokines. So visceral fat also releases cytokines. So things like IL-6, interleukin-6, TNF alpha, CRP, and these are all inflammatory responses. But obviously, if you have a lot of these inflammatory sort of molecules, they can end up decreasing immunity. Decreasing immunity can lead to increased infections and eventually worse diseases like cancer. And obviously, with more inflammation, the more inflammation that there is, the more reactive oxidative species there are. So these are obviously harmful because they cause something called endothelial dysfunction, which we'll see later, and why that's a problem. And then obviously you have vascular sort of molecules as well. So things like sort of factors that control hypertension, for example, like nitrous oxide, NO here, which is basically and vasodilator. So if you have less of that, you vasoconstrict. And then obviously angiotensin 2, which you might know from second year, which is part of the RAAS system that constricts the vessels. So if you have a dysregulation in that, you can cause hypertension, which basically increases the risk of things like peripheral arterial disease, vascular diseases. So that puts you at higher risk for cardiovascular problems. You also have clotting problems as well. So clotting factors like PAI1. So so basically factors which control clotting and the normal sort of clotting process. If you have a dysregulation in that, you can get fibrinolysis. So like fibrinolysis is a normal process, but it can become a problem if the clotting sort of factors are, in a sort of jumble or sort of not sort of controlled properly. So you can clearly see here how lots of problems, lots of these molecules are produced by the visceral fat lead to long-term problems. Leptin, I forgot to talk about leptin. So leptin, a lot of people think that leptin itself becomes resistance and leads to appetite problems, but actually leptin is the reason why leptin is an issue is because CRP, which is an inflammatory marker from the cytokine inflammatory marker, basically binds onto leptin, and because leptin needs to cross the blood-brain barrier, it can't anymore because the CRP binds onto it, and if the leptin can't go to the brain, it obviously has an effect on your appetite. So these obese people will basically end up eating even when they're not hungry. And leptin also regulates the communication between osteoclasts and osteoblasts by some particular system. I don't want to go into it in too much detail, but if there's discommunication between osteoclasts and osteoblasts, you can get several diseases like osteoporosis, osteoarthritis, and obviously that becomes even more of a problem because with obese people, they have lots of fat, which basically puts more stress on the bone. So imagine if you have these diseases and the fact that they have lots of pressure on their weight-bearing bones like the femur and whatnot, that ends up becoming a problem. So that was the obesity side. Now I want to talk about how diabetes causes obesity. So I said already how obesity can link to diabetes. How does diabetes link to obesity? Well, if you remember, or if you've studied, you'd know that diabetes, especially type 2, is very highly linked to obesity because with insulin resistance, so if you have a resistant sort of reaction to insulin, if insulin is not working in your body, insulin normally inhibits HSL, which is hormone sensitive lipase. And obviously, hormone sensitive lipase is the enzyme that produces fatty acids into the blood. So if you don't have that inhibitory function anymore from insulin, because we don't have it anymore because it's resistant, your body just constantly produces fatty acids and releases into the blood. So that ultimately releases in the more fatty acids you have, the more fat you need to compensate and accompany all this incoming fatty acids. So that's why diabetes links to obesity. Now with dyslipidemia, so dyslipidemia is essentially a dysregulation in the amount of lipids you have in your body. In diabetes, the problem is that you have less HDL and you have less LDL removal. So essentially that becomes sort of disbalanced, and you end up having more LDL than you have HDL. So this is also a problem because you're going to see now with dyslipidemia, you have several types of dyslipidemia, but a big one, for example, is that you get lots of LDL in your blood compared to HDL, and that leads to something called atherosclerosis. So atherosclerosis is essentially hardening of the blood vessels, or a part of the blood vessels, due to a fatty deposit, basically. And this fatty deposit is caused by LDL, but not LDL itself, which I'll speak about now. It's actually the process of what happens to the LDL. So the first process that happens in atherosclerosis is a so-called endothelial injury. This is the trigger. This is the first thing that will happen to develop atherosclerosis, and this will all link back to obesity. But basically, if you have lots of LDL in your blood, from dyslipidemia, for example, this increases the chance of LDL essentially binding onto the blood vessel, so the tunica intima, the inner lining of the blood vessel. Because the LDL binds onto the tunica intima, basically an inflammatory response happens. So basically monocytes come in, They come to the inner lining, and basically monocytes are recruited, and their job is essentially they come into the tunica intima, they go into the subendothelial layer of the blood vessel, and they turn into macrophages. So they transform into macrophages, and macrophages basically love to munch on LDL. So these macrophages, they migrate, and then because the macrophages, they have specific receptors on them called scavenger receptors, and they have different chemicals within their cells. These sort of transform LDL into oxidative LDL. So oxidative LDL or glycated LDL, which is the LDL that is bound on by glucose. So that links back to diabetes. With diabetes, you're likely to have loss of glycated LDL, which is not good. With oxidative LDL, when the macrophages sort of produce that, they turn into foam cells. So as a result, these foam cells release inflammatory sort of responses. So things like collagen, cytokines, so other sort of inflammatory sort of signaling molecules. So that results in smooth muscle sort of moving upwards and proliferating and growing and growing. And you also get things like neurovascularization. That just means the blood vessel, or that sort of fatty deposit with the foam cells and whatnot, basically produces its own blood vessels. And this isn't good because this is the so-called point of no return. So this is what sort of judges what's reversible and irreversible. So as soon as the blood vessels are made, you can consider that atherosclerosis absolutely irreversible. You can't, go back. That's it. Once it's made its blood vessels, that's it. Its job is done. Also with collagen, because you have lots of collagen, you basically form like a very sort of firm fibrous cap, which is basically on top of this sort of fatty streak that's been made. And once that sort of hardens and whatnot, it becomes a lesion, so a necrotic lesion, a necrosis. And then after necrosis, you get something called a thrombosis. So thrombus, basically, sort of collection, a hard collection, sort of forms into the blood vessel that can turn into, myocardial infarction, a stroke, an embolism, so pulmonary embolism, so many other sort of, life-threatening cardiovascular diseases all came from the fact that you developed atherosclerosis, which basically came back from the fact you had potentially this lipidemia or even obesity, like I said before, and even diabetes. So just a last sort of point. When a patient has obesity, hypertension, and dyslipidemia all together in one, we call that sort of group of disorders metabolic syndrome, so syndrome X. So this is when they have all those sort of three disorders combined into one, and that puts them at risk for several diseases. So that was sort of the general sort of, if you like, a big picture of how obesity, why obesity is dangerous and how it can link into other disorders and combine to make, that patient way more at risk for things like cardiovascular disorders. So hopefully that helped you guys. If there's any concerns or things that really make sense, because I know I stumbled up a bit here, please do, either comment or, DM me if you have any other questions or concerns. And yeah, thank you very much, guys.